Hello, my name is Dr. Virginia Von Schaefer. I thought I'd introduce myself and give you a brief idea of what kind of experience you might have when you obtain a consultation with me, either by phone or Skype or in person. My main interest in initially evaluating patients is to understand exactly what they have, what their current condition is, what treatments they may have had before that might impact them in the present, and to look at perhaps other parameters that other physicians have not scrutinized but may be very important to optimize your metabolism in the process of the cancer treatment. I am a very candid person, and I'm happy to entertain everyone's wishes to find out where your desires are in terms of what your treatment goals are, what kinds of treatments you want to use, what you can tolerate, what you can't tolerate. At the same time, I'll be very honest, I'm not the type of person to tell you exactly what you want to hear. If I know that something is, one alternative is going to be better for you than another, I will present that to you. Obviously, these are all choices that you have to make in your treatment. At the same time, I find very often in the field of integrative oncology and quote-unquote alternative treatments, there's a lot of telling people what they want to hear. People are afraid of chemotherapy. They say, oh, have some IV vitamin C, you'll be fine. I have many patients who've gone that route and come back with bigger tumors and more disastrous situations, and it's just not useful. And I feel it must be important to be honest with you. I also want you to know that I'm very science-based and traditionally trained, so I like to evaluate people with all the regular parameters as well as other things that maybe other doctors have overlooked. I've been treating patients in this situation for a very long time, and over and over and over again, I see that physicians have ignored the endocrine abnormalities a patient might develop and they're untreated, or there are issues with viruses, bacteria, parasites, fungi that are totally unaddressed and are holding the patient back, either in terms of not being able to get a good result with initial treatment or multiple recurrences. So we like to look at everything, and that's why I ask you for a lot of information to send to me so that I can review it and prepare myself and study what your certain case might really best be served with. Many patients come to me with unusual pathologic diagnoses, and they have a particular treatment regimen that may or may not be suggested by your traditional oncologist. We have to look at all those things and see, are the traditional methods something that you want or should pursue? Do you want to augment it with other treatments? Or are you just unhappy with the traditional offering that has been made to you and want to get another opinion as to what your other alternatives might be? So we ask for a lot of medical records and pathologic diagnoses, surgical pathology, procedure reports, all those things that are very, very helpful to put in my mind so I can understand where you're at. And current scans are obviously very, very helpful as well. When it comes to interviewing you, if I can't see you in person initially, I do like to do Skype or Zoom consults because I can interact with you and you can see me. And I can give another piece of information as to how you're functioning and how you're well and what's going on in your body. If you do decide to come and treat with me, I may ask you to do other things first, have other kind of testing, and if you're far away, we can always make those arrangements. If you are nearby and can come for a short visit to get some testing, that's a great alternative as well. We have the RGCC blood test, the Onconomics Plus test, and also the Prime Spot test. The Prime Spot is for the viruses, the bacteria, the fungi. I'm sorry, just the viruses and actually Lyme. But we have energy tests for the bacteria, the fungi that might be useful, as well as the Onconomics Plus test, which will show us chemosensitivities and good natural things that might be useful for applying to your particular case. All of this is based on a highly individualized approach. Every person is different. No two people with breast cancer are the same. No two people with colon cancer are the same. So we like to see what are your personal issues, what can we do to optimize you, and what else do we need to do to treat you to get you on the right path. Once that's achieved, then we can sit down and decide what's the best course of action. My forte is to create synergy of multiple treatments and try and strategize to have an intense period of treatment, at least initially, if there's a cancer problem that's out of control. If you come to me and you've had surgery and you're doing well and you just want to see how you can prevent things, then that requires a different strategy. Patients who are ill and have large tumor mass, and many of my stage 4 cancer patients are in that category, we have to sit down and decide how are we going to attack this. And I like to create programs that have short-term block and then possibly home plan, or longer term, depending on what your situation is. I also pride myself in being very practical. I like to give you a treatment plan that's efficacious and it's going to give you the best result for the money you spend. There are many institutions and clinics where just give the routine cookbook, the vitamin C, the this, the that, the ozone, the coffee enemas. Okay, those things are all good as adjuncts, but they may not necessarily be good primary agents and help you achieve the result that you want to get. So we have to kind of look at everything and come together between you and myself and your family members as to what you want and can do, and see if we can make this workable together. So I also like to emphasize that there is a certain energetic and spiritual component to interaction with patients, which I'd like to focus on and subtly work on, because basically healing occurs in many, many areas. Illness is an opportunity for all of us to reevaluate everything we do in our lives, and it may have to do with relationships, not only with others, but ourselves, our past issues. All of those things come into very important play at one point or another in your treatment. And I think it's best to acknowledge that that's an issue. Now, we may not look at it right away, we may not do all kinds of things, but we have to understand, yes, at some point, I'm going to go there. I'm going to work on that. Because when you do, when you are sick and you get better, it's my experience, my personal experience, that your life changes. And you want to prepare yourself for that. You want to see, okay, what's for me next? Where am I going? And once I achieve this goal of wellness, what's in it for me beyond that? And this is what all of my patients who've achieved a great result have to go through and want to go through, because their life is going to change and they're going to want to see what their life is going to be like beyond this illness. Some of my patients describe it where you do intensive treatments and then finally they get better and they say, I want to get out of the cancer prison. I don't have to be worried about doing coffee enemas all day long and taking all these supplements and doing all these things. I want to do something that's going to help to maintain me, but I want to move on with my life. And I don't want the focus of cancer to be the primary thought in my mind every day as soon as I get up. So these are all things that come and evolve naturally if you're guided properly, and we like to do that because the goal is to get you better, have you move on, and live a full life. So when we have these consultations, this is what we try to achieve. Just so you understand, though, there are many places that have advertised programs. Okay, you can come for 8 weeks, it's going to be $75,000, or 12 weeks, it's going to be X amount of dollars. And it's a kind of a set program. I prefer not to work that way. I always give people estimates of costs. At the same time, you're going to dictate what you can tolerate and what's best for you. And so sometimes we have to try treatments, and if they don't work or you're not tolerable, then we have to change them, and we have to change the program. So I make it a point to have all of my patients see me when they're intensively treating with me in person, to meet with me at least once a week briefly, so I can get an input from them as to, what's going on? Do you have side effects? Is there a problem? Maybe people don't want to talk about things, or they think it's not a problem, but I know how to interpret these things, and I want to make sure I have all the information I need to really treat you best, okay? So it's a kind of a two-way street, and yes, I do want people to be committed to their treatment. I want to believe in what they do, and I work very hard to try and educate you and inform you and direct you as to what I think is going to be the best outcome. That's always my goal. How can I create an outcome that's best for this patient and is tolerable and cost-effective, really? So I invite you to, if you are considering a consultation, just to even get us another opinion. I always encourage patients to have an oncologist in addition to an integrative oncologist, just because you need services from some of these people, and some insurance plans you're required to have an oncologist in order to get scans and other valuable tests and treatments. So it's a group effort. And I'd like to, make sure that everybody who's participating in the team is on the same page, as it were. Sometimes you'll have that with an oncologist, and sometimes you won't. But there's many people who are willing to work with patients when they realize that they can't tolerate or don't want to tolerate traditional treatment. So just bear that in mind when you're looking for another opinion. I'm here to assist you and give you another point of view. Thank you for your attention.